I don't know if the current generation saw people use chewing stick,
Some
but
people use
it
both.
was something that when I was in if one secondary school like that, one of the plenty secondary schools I went to, which I wasn't so great at. Some people used to bring chewing stick and use that to clean their teeth. You said some people use what?
Both.
What's
Yes,
that?
when you're done with the chewing stick, they brush their teeth.
And then some people just use floss. And so there are so many myths like, is sugar bad for my teeth? If someone's teeth is pure white, does it mean the person has healthier teeth than someone brown teeth? And all of that is what we would like to learn about today. And so joining us we have.
We have Chooks Agbapu, who is a dentist at Deluxe Dental. Good morning
Good
and
morning.
welcome
Good
to the
morning. Thank you
show.
very much. Good morning.
Chooks. I'm just here to learn because I know almost nothing about this besides having to brush my teeth twice a day. First of all, how many times a day should people brush their teeth and how important is dental hygiene?
Ideally, we should brush our teeth twice a day, in the morning before every meal, and the last thing before you go to bed. That's the best. That's the proper way to keep oral hygiene. Keep your oral hygiene intact. Brushing twice a day. Then also flossing. Flossing is a very important dental hygiene habit we always advocate for patients, because the bristles of your brush, there are some areas they cannot get to on in your oral cavity, like the interdental areas. Interdental areas with the spaces, those tight junctions between adjacent teeth. So most of the time your bristles will never get there. So it's best you use a floss. Floss gets to approach those areas and brings out food particles that would have been stuck in those areas. So basically, those two are the most important oral hygiene habits.
So while he was talking about floss, if you could tell I was smiling. I'm now at an age where certain things get me very interested. I have a massage gun and I have this water flush floss bit where it's a device and it uses water to pretty much clean your teeth. And that's because for some of us who love meat so much, whenever I eat, it goes everywhere. And like you rightly said, sometimes the toothbrush wouldn't be able to get there.
And
also, even the floss, it may get hard, but that has helped. But you wanted to speak to that?
Yes, there's another mistakes people do make generally using toothpick. You know, you mentioned meat getting stuck in the interdental areas. People most of the time tend to use toothpick to poke those teeth out. Those are also bad oral hygiene habits, because these toothpick will always cause you more periodontal issues. They are sharp pointed end, so you poking them in those areas creates a gap where food could always be accumulating. So in the long run, you could be predisposing yourself to what we call periodontal pockets. The spaces get created there, food gets stuck in and causes more infections, causes some periodontal issues or periodontitis. And in this case, sometimes it might even lead to you having to lose those tooth.
So what's a better option as opposed to toothpick?
Floss. That's why we recommend flossing. Flossing is more advisable and is more hygienic than using toothpicks.
So what are the key benefits of oral care to our overall health?
Well, when the benefits of oral care is quite wide. Number one, it's when you brush, you keep your mouth clean, free from germs. You stay away from disease. You also stay away from periodontal issues, like I mentioned, and also the halitosis part. You know, if you don't brush, definitely your teeth is your mouth is going to smell. So when you brush, you get that part away. Then when you also brush, because when you don't keep your teeth healthy, you predispose them to caries or dental cavities, and these dental cavities will always cause patients pain, sensitivity, and when you're in pain, definitely you can't be productive at work, at home. You can't even sleep because of the pain it causes you. And if you ignore these caries, they could progress to something more debilitating or even life-threatening. So that's why we always advocate patients to brush twice a day, keep a good oral hygiene, keep a good oral habit, and all that. So when you ask for the benefits, it's quite encompassing. The aesthetic part, you know, if your mouth is not clean, definitely it's not going to be looking nice, you know.
How often should we visit a dentist?
Ideally, it's once every year. You should visit your dentist once a year. And then there's a part we call there's a procedure we call scaling and polishing. Scaling and polishing is just the process of taking out plaques and calculus from our teeth. When you know plaque and calculus in this case means those yellow deposits you see on patient teeth when they smile. Definitely, if you brushing is not going to take it away. You understand? So most of the time, we advocate for scaling and polishing. It's a procedure where we tend to get those plaques and calculus out of your teeth. So ideally, scaling and polishing twice a year. Then you visit your dentist at least once every year. Yeah.
So I read in an article which says that there are over 6 billion bacteria in the human mouth and over
Not really
700
billions, millions.
and so we've seen some people say millions, some people have said billions.
Okay.
But you spoke about halitosis, and I'm guessing that's mouth odor. Yeah?
Yes.
Now, I have noticed, and I've seen this on social media, where some people now have super white teeth, where it's like you can go to Turkey and buy new teeth. So there are a lot of these procedures which people are now using to ensure that they have perfect teeth, and it's pretty much glowing and all whatnot. Is that really safe? And are there long-time health implications we may need to know about?
And when you talk about white teeth, you know, most people, like I said, your smile is your confidence. If you have very white teeth, you tend to smile better, and then you're more confident when you speak. So when you talk about white teeth, there are actually basically some procedures you can get white teeth. Number one is by tooth whitening or tooth bleaching.
Yes,
Though there are some
bleaching.
school of thought, some say it's not healthy, some say it is, but they've not really found any. There is no data that found that bleaching is bad for the tooth. But then you talk about the ones that go abroad to do get extremely white teeth. Those ones we call them dental veneers. You know, veneers are more of like when we try to mask your teeth with some materials. So when you smile, we've seen the veneers. So it's still okay. There's nothing wrong with veneers. If you want them, you can go get them. There's no issues that comes up with them. All you just need to do when you have these veneers, or you just keep a very good oral hygiene so they don't get dirty along the way or get infected and all that. But beyond that, there's really nothing wrong in those procedures. They are very safe, and they're all good.
Talk about sugar. Sugar and sweet things, are they really bad for our teeth?
Well, it's when you say sugar. When you say are they bad, people definitely take sugar. So it's not about it's not about if it's bad or not. People definitely take sugar, no matter how you say don't take sugar, don't take sweet things. People always take chocolates, ice creams, and all that. But the main basic thing is brush. You understand? Because the concept is when these sugars are left in your mouth uncleaned, the bacteria in your mouth decompose them, and they will tend to produce acid. So this acid would wear away the mineral parts of your tooth gradually. So that's why we always advocate, even if you're going to take chocolates, even if you're going to take sweet stuffs, even though we try to say, hey, don't take them, but you know, people would never listen. But even if you're going to take them, brush twice a day, basically, and most importantly, before you go to bed. Very important, because at night when you are asleep, the saliva production in your mouth is way reduced. So bacteria tend to have a few days without much saliva in your mouth. They destroy these food remnants, sugary remnants in your mouth. They produce acid in the long run. This acid wears away this enamel and your dentin, creates those cavities, and from there, a myriad of problems arises. So even if you're going to take those things, just brush it. You'll be fine.
So before we go, what are some common misconceptions that you would like to address? For example, Andy using the chewing stick in the morning.
Not
Is
chewing
that
stick, and I'll use the recognized what I've told you.
Well, studies have been found that chewing stick is actually not bad for the tooth. Even though then they found that it also contains some elements that is also good for gingival health. But the problem is this: chewing stick would definitely not brush your tooth properly the way brushes and interdental aids would brush your teeth properly. So even if you're going to use chewing stick, it's not still a bad idea to also still use your brush. And even when you're brushing, there's a technique to brushing. You understand? There's a technique to brushing. We see people brush with so much force on it. You know?
Yeah.
And those kind of techniques of brushing will always cause you more issues, because the more force you apply with your brush, and there are some patients too, they always tend to use hard brush. we don't advocate hard brush. We usually advocate for medium bristles brush. But we see some patients using hard brush. Not only using hard brush, they brush with so much force. And they keep telling you that if I don't brush that way, it's as if I've not brushed properly. But in the long run, those forces will cause damage to your gums, cause gingival resection. When we say gingival resection, your gums begin to recede, they begin to move away from the crown of the tooth, and at that point they begin to expose the roots of the tooth, causing sensitivity, and when you eat or take something cold, you begin to feel that that pain. So it's all about brushing the right way with the proper technique. There's a technique to brushing. If you follow me on our Instagram page, you would see the proper brushing technique, how you should tilt your brush, the head, how you should tilt it between the gums and the tooth, how you should sweep and all that. And basically you also try to use fluoride containing toothpaste. Very, very important, because fluoride also helps to make our teeth strong. So we also advocate for fluoride containing toothpaste. So dental care is actually a very, well, like I said, it's an encompassing topic. Even in children, you have to talk about dental care in children and all that. So well, basically these few tips are just what we should hold on to.
Chooks, thank you so much. You can find them at deluxe_dentalng on Instagram to learn how to brush properly. They are based in Gwarinpa in Abuja, and I'm definitely paying a visit within the next 2 weeks because I should. But please, your dental hygiene is as important as your physical and body hygiene, and so you need to take care of your mouth, because after your physical looks, what comes out of your mouth matters, and it needs to come out smelling well. That's all we can take for the lifestyle segment. We have Tenda, who will be joining us next on Entrepreneur Spotlight. Don't go away. We have a whole lot more for you on the Weekend Show today.